Hello, my name is Lauren Megahey. I'm a psychiatrist and I'm in training to become a consultant. Across the UK, many patients attend memory clinics every week, and some of my patients haven't known what to expect. We understand that having memory problems can be really frightening and frustrating, and I hope that this podcast today will answer some of your questions and alleviate some of your worries. Today I would like to talk about being referred to the clinic, what happens at the clinic, and what happens after you attend. The first thing I'm going to talk about is how you actually come to be referred to the clinic. The first step is noticing that there is a memory problem. This can often first be noticed by family or friends. The next step is making an appointment with your GP. They will ask you some questions and perform some memory tests to see whether or not you need referred to a psychiatrist. If this is felt to be necessary, the psychiatrist will then send you out an appointment letter. This letter will usually have the date, time and location of your appointment. It's really important to tell the clinic if you can't attend so that your appointment can be rescheduled. Your appointment letter will likely have the name of your consultant on it. However, you may see another member of the team, for example, another doctor in training such as myself, or another qualified health professional like a nurse. Don't worry if you don't see the consultant, as we all work together as a team and discuss cases to ensure that you all receive the best possible care. So we've talked about how you get referred to the memory clinic. Now I'd like to talk about some things that are important to bring with you in order so that you can get the maximum benefit from your appointment. It's really helpful if you can bring a medication list with you, as it can be really difficult for anyone to remember the names and dosages of their medications, particularly if you have a memory problem. If you wear either glasses or a hearing aid, please bring these with you as well, as you will need these later on in the appointment when you're doing some memory tests. We also strongly advise that you attend with a trusted relative or friend. This can be helpful for a couple of reasons. First of all, they can help answer questions that the psychiatrist may ask, as you might find it difficult to remember everything you'd wanted to say. Another point is they can help you remember information that was given to you during the appointment, as we know it can be a lot to take in. So we've talked about being referred to the clinic and discuss some items that's important to bring. Now I would like to talk about what actually happens when you attend the clinic. First of all, you report to reception and then you take a seat in the waiting area. Your first appointment is likely to last around 1 hour. This can seem like a really long time, but there is a lot of information that the psychiatrist needs to gather the first time they meet you. The psychiatrist will start off by asking you some questions. We call this taking a history. First of all, they will ask you about your memory problems and some questions such as when this started and what you've noticed. The psychiatrist will then want to know all about you. They'll want to know if you've had any medical problems in the past, such as diabetes or heart problems, or whether you've ever been in hospital. They'll want to know if you've had any past mental health problems and if there's any history of this in your family. For example, if anyone's had depression or if anyone else has had memory problems. The psychiatrist will want to know all about your life. Questions such as who do you live with, how do you manage with day-to-day activities such as washing, dressing, cooking and shopping. They'll want to know whether you get out and about to see your friends. They'll also want to hear about your medications, and as I've mentioned, this is where it's really helpful if you can bring a list in with you. It may seem like the psychiatrist is asking you a lot of questions, but this is so that we can get a full picture of how things are. The questions unfortunately don't stop there. The psychiatrist will then go on to ask you some questions to help assess your mood, how you're thinking, and whether there's anything unusual going on, such as hearing voices or seeing things. Some of these questions may appear very strange, but don't worry, we ask all our patients these, and they're so that we can check for any other mental health difficulties such as depression. So the psychiatrist has asked you lots of questions. The next thing they'll ask you to do is a memory test. There are different memory tests available, and which one is used will depend on your needs. Examples of questions that you might be asked are questions to test orientation. For example, what day is it? What date is it? What year is it? Where are you? What is the name of the county you're in or the country? You may be asked to repeat items or words that the psychiatrist has said and then asked to remember these later. You may have tests of concentration. For example, spelling a word backwards. You may be asked to draw a diagram or follow a command such as folding a piece of paper and then dropping it on the floor. Depending on the memory test used, you may be asked to name animals or other items from diagrams or pictures. There can be a lot of different questions asked, and some of these may seem strange, but all these tests have been validated with large studies that have proven their accuracy and they help psychiatrists to test different parts of the brain and see where the problem lies. I've mentioned before that it's really important to come along to the appointment with a relative or friend. The psychiatrist will want to speak to them to find out what's been going on from the point of view of someone who knows you well and cares about you. Doctors call this a collateral history, but it's really just a chat with your relative or friend. This is a really important part of your hour-long consultation with your psychiatrist in the memory clinic. So you will have been asked some questions, performed a memory test, and the psychiatrist will have spoken to your friend or relative. The next step is for the psychiatrist to request some medical investigations, for example, blood tests, brain scans, or heart tracings. Your GP will already have done a physical examination. This is really important because physical illnesses can have an impact on the memory, so it's vital that these are detected and treated. The psychiatrist will request some blood tests, for example, a full blood picture to check for things like infection or anemia. They will also request tests of your kidney function, which can look for dehydration. We also like to test your thyroid function, your liver function, your blood sugar, and some vitamin levels such as vitamin B12 or folate. A CT scan will likely be requested. This involves an appointment at the hospital where you lie down on the scanner and pictures are taken of your brain. This can sound frightening, but it doesn't hurt at all, and the actual scan doesn't take very long. You may need to wait a little while for your scan appointment though. An ECG may be requested. This is a tracing of the heart which looks at the electrical activity. Again, this doesn't hurt at all, and it can sometimes be done at your GP surgery. This only takes a few minutes. Other medical investigations may sometimes be requested, for example a chest x-ray, but this will depend on your own specific circumstances. So we've talked about some investigations that the psychiatrist may request, for example blood tests, brain scans and heart tracings. Sometimes your diagnosis will be clear at your first appointment, but more often than not, the psychiatrist will need to wait for the results of these investigations so that they can put all the information together to decide on your diagnosis. Once this is done, a management plan can be agreed. Some patients may actually be reassured that their memory is normal, and if this is the case, you will be referred back to your GP. If a memory problem has been detected, you'll be offered a review appointment at the memory clinic. This is much shorter than your initial appointment and will last around 15 to 20 minutes. Treatment plans can include things like medications, help with your everyday life, and talking therapies. Some patients are prescribed medication specifically for their memory, but this will depend on your diagnosis. You may also be prescribed medications for any physical problems that have been detected or any other issues such as low mood, which we call depression. I've mentioned before that the psychiatrist will ask you lots of questions about your day-to-day life and how you function, with things like washing yourself, dressing yourself, shopping and cooking. This is so the psychiatrist can assess whether you need any help in these areas. We call this social care. This is a very important part of our treatment plan and can make a real difference to the quality of people's lives. Talking therapies can sometimes be useful. For example, something called cognitive behavioural therapy or CBT. CBT helps patients to see how their thoughts can be linked to distressing emotions. It can all sound a bit complicated, but in short, CBT aims to change the way you feel by changing the way you think. Whether or not you're offered treatments like this will depend on your individual needs and also on which services are available locally to you. Voluntary agencies can play a huge part in treatment as well. They can provide a lot of information and support both to yourself and to your friends and family. For example, the Alzheimer's Society or AIDS UK both do fantastic work. So I've talked about how you get referred to the memory clinic, what to bring with you to the appointment, what happens at the appointment and what happens afterwards. I would just like to finish with some summarising points. You are normally referred to the memory clinic by your GP. It's really important to bring along a medication list, glasses and hearing aid if you have them, and also to come along with a trusted friend or relative. Your first appointment at the clinic will last around an hour, but subsequent appointments will be much shorter at around 15 to 20 minutes. Your management plan will be tailored specifically to your needs so that we can give you the best care. There are lots of sources of support available, many of which are listed on the Royal College of Psychiatrists website. As I have mentioned, the voluntary agencies also do fantastic work, for example the Alzheimer's Society and AIDS UK. I'd like to thank you for listening to this podcast. I really enjoy working in the memory clinic, but I know my patients have sometimes been unsure what to expect and have sometimes felt a bit frightened. I really hope that this has helped alleviate some fears you may have had and answered some questions. Thank you.